Hello everyone, welcome to Texture Myth. In this session, we are going to talk about another very important topic related to medical coding anatomy, where we will see what is the exact meaning of medial anatomical term of direction. So if you remember, in our previous session, we talked about other medical anatomical terms of direction like interior, posterior, superior, inferior, right? So this session is in the continuation of the same, where we are going to talk about the medial anatomical term of direction. So by the end of this session, you will be able to understand what is medial anatomical term of direction, what kind of information it can provide, how it is utilized in medical coding, clinical terms, and examples. Okay, so I'll walk you. We will not discuss on only the short definition, but we will also see the all examples so that it will give you more clarity. Okay, and at the end of the session I'll give you some tricks to remember these concepts, and also I'll provide you some sort of questions that will help you to recall your concepts. So if you are preparing for interviews in an exam, here you will find a perfect note that you can refer. Okay, but before we proceed further with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic, because for time being we are just mainly focusing on medial anatomical term of direction. But prior to that, you should know about other anatomical term of direction that we have already covered. Clear? Alright, so let's get started. Here you can see, firstly I have noted down the definition of medial, which is quite simple, that medial means toward the midline of the body. Okay, so in simple word you can say that any structure or body part that is closer to the imaginary vertical line that divides the body into left and right half is called as medial. Okay, so medial means toward the midline, toward the center of the body. Now to explain it in a very simple way, I have noted down another definition that will answer what is midline. So the midline is an imaginary vertical line that runs from the top of the head down to the feet, dividing the body into two halves, left half and right half. Okay, so just imagine that one person is standing and there is an imaginary vertical line from top of the head to the feet, dividing the body in two halves, left half and right half. Then it is called as midline, median line. Okay, median line, sorry, not midline, it's median line. It is also called as median line and midline. Okay, so it runs through the center of the body, passing through structures like nose, belly button, sternum and spine. So any structure that is closer to this line is called as medial, and any structure that is farther from this line is lateral. Okay, so you can say that midline as a center of the line on the road, structure on the midline side are closer to the center line. Clear? So I think definition wise we are good, like what is medial. Now let's talk about the opposite term, because we all know that every term has its opposite term. So the direct opposite term of medial is a lateral. Okay, so medial is equal toward the midline center. Lateral is away from the midline toward the sides. So these two always work as a pair. You cannot understand one without knowing the other. So here you can see the nose is medial to the eyes. So just imagine that vertical imaginary line. Now nose is the structure which is on the midline, right? And ears are something that are on the sides. So that's why we can say that ears are the lateral to the eyes. Okay, but nose is the medial to the eyes, and we are using it in a relative way, one comparing with another one. Clear? Now let's see some example. These examples will give you more idea. Okay, so here you can see the nose is medial to the eyes, which means the nose is closer to the midline than the eyes. The sternum is medial to the ribs. The ulna is medial to the radius. The tibia is medial to the fibula. The big toe is medial to the little toe. So what is one common thing in all these sentences is medial. That means midline, towards the midline of the body. Clear? Now we will talk about some of the combined directional terms with medial, right? So medial can be combined with other directional terms to be more specific about the location. So if you want to specifically target any locations or show any location, so you can combine it with other term like superomedial, which means toward the upper part and toward the midline. Inferomedial, that means toward the lower part and toward the midline. Anteromedial, toward the front and toward the midline. Posteromedial, toward the back and toward the midline. Okay, so these are the all combined terms that can be utilized in order to show the specific position according to the word that we are using. Now look at some of the clinical example I have mentioned here. First example says a superomedial orbital wall fracture. That means a fracture is in the upper inner part of the eye socket. Clear? Then we have a inferomedial patellar dislocation, means the kneecap has slipped downward and inward. Third point says an anteromedial approach in knee surgery, means entering from the front inner side of the knee. A posteromedial tibial means fracture, means a fracture on the back inner side of the shin bone. So these are the all examples where we are using the term medial, which is denoting the midline or towards the midline or center of the body or the structure. Clear? Similarly, there are use of this term in medical coding also. So in medical coding, ICD TAM, CM, CPT, the word medial appears very frequently, right? So medial collateral ligament tear, that is MCL, tear of the ligament on the inner side of the knee. Medial meniscus tear, which means tear of the inner cartilage pad of the knee. Medial epicondylitis, inflammation of the inner elbow, also called as golfer's elbow. Medial malleolus fracture, a fracture of the inner ankle bone. So these are the all terminology where medial is utilized just to show or to represent the midline of the body or other structure. Clear? Now we have learned so many terminology examples, right? So we should know some of the tricks that will help us to understand the topic. So in medial, when you look at the first character, it is M, so you can denote it with middle. So whenever you see medial, from first letter itself you will get the information that M means middle, so toward the midline or the center. Now the simplest way to imagine this thing is, just imagine standing in the middle of the road. The center line is the actual midline. Okay. Now similarly, structure closer to the center line is medial. Structure farther from that center line is the lateral. So this is how you will identify whether any structure or body part is at the medial or at the medial or at the farther, that means lateral of it. Clear? Fine. Now here you can see the conclusion. Medial means middle, closer to the center of the body, or think of it as medial, that means center of attention, the middle. Clear? So I think with these all information, medial anatomical term of direction is quite clear to all of you. Now I will provide you one question. I'll ask you one question. So today's question is, what is the meaning of caudal anatomical term of direction? I'm sure you already know the answer of this question. So please do share your expertise in the comment section so that others can learn from your answers. Okay, it will really help others, those who are not aware of this topic. But in case if you also don't know the answer, it's quite fine. Like you can refer the previous session. There I have discussed this thing in a detailed manner. So from there you can learn, and then you can share your knowledge in the comment section. But please do share your knowledge through comments, because once you start writing comments in the comment section, it will give me the instruction that yes, you guys are learning from this session, and accordingly I will publish more and more sessions. Okay, so please do share your knowledge in the comment section. It will really help us to reach wider audience, and also it will indicate me that you guys need more topics related to that. So yeah, that's all for today. See you in the next session with new topics. So thank you for watching TechSharmit.